Cluster A, B, and C personality disorders. There are three clusters, Cluster A, B, and Cluster C, and each of them has 3 or 4 types of personality disorders, and I'll go through each of them in this video. So the first cluster is known as Cluster A, and these personality disorders are described as odd or eccentric, and there's 3 of them. There's paranoid, there's schizoid, and schizotypal. Paranoid basically is a disorder in which the person has a pervasive distrust or suspiciousness of others, such that their motives are interpreted as malevolent or evil. So a perfect example of that is a patient that's admitted to the hospital and he does not trust the nurses. He's very suspicious of them, and when they offer him medications, he thinks that they're trying to kill him. So paranoid is the first one. Next one is known as schizoid. Schizoid is a pattern of detachment from social relationships and a very restricted range of expression of emotions in interpersonal settings. These types of patients do not want friends. So it's very, very clear that they want nothing to do with social interaction. The next one is known as schizotypal. Schizotypal can be thought of as a pattern of strange or odd behavior, strange or odd appearance, and also strange or odd thinking or belief systems. They're not really schizophrenic because they don't have any psychotic episodes, but they are quite odd and strange in the way they behave, the way they look, and the way they think. Now we get into Cluster B. Cluster B are personality disorders that are characterized as being either dramatic or emotional or erratic. And there are 4 in this category. And these 4 are histrionic, narcissistic, antisocial, and borderline. Histrionic is basically a person that's very flamboyant, attention-seeking, very kind of seductive in their appearance and behavior. And this person is very clear in the way they demonstrate their excessive emotionality. Narcissistic is the next one. This is a person that has a grandiose sense of their own importance. And essentially the perfect example is just like a Hollywood actress who thinks that she's absolutely the greatest and that everywhere she goes people should, treat her like royalty. So think about somebody who has a very heightened importance of their own self. Next one is antisocial. Antisocial, unlike the term implies, does not mean that this person does not want to have social interaction. I don't know why they call it antisocial. Antisocial actually means that this person violates the rights of others. This person has no respect for the law, is aggressive, lies, and has a lack of remorse. That is what antisocial personality disorder is referring to. And the 4th one in this cluster is known as borderline. Borderline people have very unstable self-image, very unstable relationships with others, and they also have this kind of splitting type of behavior in which they view everything and other people as either all good or all bad. The next cluster is known as Cluster C, and this cluster is a group of personality disorders that are characterized as either anxious or fearful. And there's 3. There's avoidant, dependent, and obsessive compulsive. Avoidant are people who are very timid and shy, and even though they wish to have friends, they are so uncomfortable and afraid of rejection or criticism that they avoid social contact, and they also exhibit low self-esteem. Dependent personality disorder are people who are passive and they allow others to direct their lives. These people basically are lacking self-confidence and they see themselves as helpless or stupid, so they let other people control and run their lives. And the final one is obsessive compulsive. This is a personality disorder where a person is like a perfectionist, very unflexible, They are preoccupied with tiny details, and they do not like changes in their routine. So now let's take a look at a few vignettes. Staff members in your practice often complain about one of your patients. He exhibits odd behaviors and odd beliefs, and is always very anxious about his visit and about when he will be seen, despite long familiarity with your practice. Which one of the following personality disorders best fits the description? Any type of person that has odd behavior, odd beliefs, odd appearance, or strange behaviors, appearance, and belief system can be characterized in the schizotypal category. They're not quite there in schizophrenia yet, but they are definitely different. Next one. 47-year-old unmarried woman appears at the physician's office complaining of dizziness and pain in her stomach. Although she describes her symptoms in a flamboyant, dramatic manner, physical exam is unremarkable. Throughout the exam, she is flirtatious and comments on the close and intimate relationship she hopes to have with the physician. With tears in her eyes, she asks if she will be all right and then laughs when the physician seeks to reassure her. Her history is significant for previous treatment for alcoholism. She has changed physicians 4 times in the past year. Based on the initial encounter, the patient's behavior is most consistent with which of the following personality disorders? Anytime you have a clinical vignette with a history of flamboyant or flirtatious behavior, that it fits the category of a histrionic personality disorder. 48-year-old actor is admitted to a major medical center with complaints of malaise and cough. He is diagnosed with influenza by the emergency room physician and sent home, but demands to be seen by the chief of staff because he feels he is not getting care appropriate to his own importance. On the way down the hall, the man tells the orderly that he should have been nominated for an Academy Award but was passed over because of jealousy among his co-workers. Which of the following personality disorders best describes the man's behavior? This is a perfect scenario of somebody who has a great sense of importance, and that is narcissism. And finally, 24-year-old woman is brought to the clinic by her parents because of problems with social skills. The parents are concerned because the patient constantly needs help making decisions and can never assert her own opinion, even regarding such unimportant issues such as clothing and cosmetics. She feels extremely uncomfortable when alone for more than a brief period and is intensely afraid of being left to care for herself. She often feels helpless and fears confrontations or disagreements with her parents and co-workers. This often has led to significant problems at the workplace because of her difficulty in initiating projects or doing things on her own. Which of the following personality disorders is the most likely diagnosis? Well, this is a perfect example of someone who is really unable to direct their own life. They lack self-confidence and they have the inability to make their own decisions, and that's a perfect example of a dependent personality disorder.